Frank Miller here. We have an order to insert a 14 French nasogastric tube as needed for any absent bowel sounds. So I'm just going to grab my supplies. I will need an NG tube, making sure that it is 14 French as the order states. My patient will need a glass of water with a straw, lubricating jelly, water soluble lubricant, making sure I grab a functioning pen light, a tape measure, some tape, pH paper, safety pin, need an emesis basin, and chucks for during the procedure. We'll need a tube syringe and a tongue blade to check the pH. And then you can use specific NG securing tape to secure it to the patient, or you can use a split piece of tape. So I have both of those. Gloves are in the room, and then a stethoscope to do the abdominal assessment for my patient. All right, ready to go into my patient's room. Hi, my name is Caitlin. I'm going to be your student nurse today. Close the door behind me or close the curtain for privacy and wash my hands. Can you state your full name and date of birth? And he states Frank Miller. I'm checking this against the MAR for the order. Date of birth is 7/4/58, so it looks good. I see you have an allergy bracelet on. Can you verify your allergies for me? Mr. Miller states he's allergic to penicillin and Lipitor. All right. Frank, I'm just here today. We're going to be placing a nasogastric tube. It's a tube that goes in through your nose and it'll end up in your stomach for any absent bowel sounds. It sounds like you might have a small bowel obstruction. You've had a lot of nausea, vomiting, some distension and pain in your stomach. So hopefully this will help as you talk to the doctor about it. Before we begin, have you had any major facial trauma or facial surgeries? Patient states no. I would ask if he's had any sinus issues, any deviated septums that have been taken care of. All right, and this may sound like an odd question, but do you breathe better out of one nair or nostril than the other? If he's not sure, I can do a test. I'm going to close one nostril and just have him breathe like normal, and then I would close the other. All right, both seem fine to me. So I'm just going to insert into your right nostril if that's okay with you. Patient agrees. All right, you're going to move your call light. We also just want to check your abdomen and do a quick assessment on that. So I'm going to lay your head flat. I'm just going to pull up your gown here. First, I'm going to looking for any unusual distension. He might be slightly distended because of the obstruction, but I'm looking for also any masses that appear abnormal. Next, I'm just going to listen in all four quadrants. When listening, if I didn't hear any bowel sounds, I would listen for 2 to 5 minutes in each quadrant just to make sure I'm hearing correctly. Next, I'm just going to press on your stomach. If you have any pain or discomfort, please let me know in any areas. During this, I can also feel for any masses I didn't see. Okay. Cover it back up. And then for the procedure, we're just going to raise your bed back up to a 45-degree angle. before we begin, I do have to just measure this for our records. Measuring from the nair to the earlobe, and then from the earlobe to the xiphoid process. I'm placing a piece of tape so I know where to measure to. It is 20 inches, which is within the normal range. Just placing a checks just in case you do get sick or any water spills. Do you have any questions about the procedure before we begin? He says no. It might be a little uncomfortable, so I do want to talk to you about a distress signal. If you are experiencing any severe problems breathing, if you're choking, or if the procedure becomes too much for you, I just want you to raise one of your arms and we can stop momentarily. Slow it down. I'm also going to place this emesis basin there for you just in case we get sick. And here's a water glass for when we are doing the procedure. I'm going to lubricate 2 to 4 inches with water-soluble lubricant. Okay, for this first part, I'm going to have you tilt your head back while I'm inserting it through your nose. You might start coughing or gagging, and at that point, I'm going to have you tuck your chin to your chest while you're sipping some water, okay? All right, ready to begin? Head is back. I'm inserting. Okay, Mr. Miller does start coughing, so he's going to tuck his chin to his chest. If coughing persists, I'm just going to take a look to make sure that I'm in the right location with my pen light and tongue depressor. All right, and as Mr. Miller sips and swallows, I'm going to advance the tube further, pausing while he breathes. Takes another sip and swallows. Advance the tube, and another sip. I'm advancing all the way until I hit the original piece of tape. All right, we're just going to secure this so that it doesn't move on you. I would also make sure not to put the tape over his nair so that he can breathe as normal. Okay, I'll take this out of the way for you. Next step, we're just going to verify placement that it's in your stomach. I'm going to clamp. Here's my Toomey syringe. We just need a little bit. Clamp, making sure that pigtail is above the stomach height. Going to place in the testing area. my sample. And we're gonna wait to let that dry for 30 seconds. And while that's waiting, Frank, we're also going to send you down for x-ray today to verify placement, that it is in your stomach, okay? All right. Then when you get back from x-ray, we'll hook you up to suction for you. Hopefully this will help relieve some of that distension and pain you've been experiencing. Okay, my 30 seconds is up. My pH does show that it is within 0 or 1 to 4, which is normal pH for the stomach acid. If it were slightly higher, you could notice a pH of 5 if your patient's on any PPIs or H2 blockers for that. So always noting your medication of your patient. Before we send you down for x-ray, I'm just going to secure this to your gown so it really doesn't move. Does everything feel okay so far? Yeah. Okay, we're gonna get you down to x-ray. They're gonna check placement. Patient does come back, x-ray confirms placement. So next, we are going to get suction started. Making sure it's off, making sure my red tube is connected to the vacuum, and the tube that I'm connecting to the patient is on the patient's side. I'm gonna turn it on. And just making sure it's within that 60 to 80 range. Turning to intermittent. Same thing. I also have my connector piece connecting the suction and unclamping. Always want to make sure that pigtail is above the height of the stomach. Frank, can I get you anything else or answer any questions you have at this time? No? Okay. Here's your call light. Please contact me if you're feeling sick, if you do get sick, or if you have any other questions or concerns. That's in the list position. Patient has his call light. I'm going to clean up and take all of my items out of the room. And then go ahead and document. And that's 11:55. 14 French nasogastric tube place.